Hey everybody, it's Jessica DaMassa with WTF Health. What's the future health? We are talking to the who's who of health tech and healthcare innovation. And today, everybody get excited. We have the CEO of one of the most valuable digital health startups out there. Please meet the CEO and co-founder of Hinge Health, Dan Perez. Dan, it's a pleasure to have you with us.
Thanks so much, Jessica, for having me.
Well, the reason we are talking to you is this big, massive fundraising deal that you've closed here at the top of 2021 already, $300 million in the bank. And probably what was more exciting about that news was the valuation attached to your business with that raise, $3 billion. Talk of an IPO, which we'll come back to in a second. But before we do that, I want to dive in to what you guys do over there at Hinge Health, because I feel like you've been kind of, for as much money as you have raised, a total of like $426 million, you've been kind of stealth. I mean, we were saying before in the pre-interview, I heard your name the first time as a potential acquisition target back when you were affordable, as one of those chronic condition management companies that was looking to build a platform approach to a bunch of comorbid conditions. But, you guys have a life of your own as a company tackling musculoskeletal conditions. So tell me about that. I mean, paint a picture for us about the market that you're serving and what Hinge is doing that's so different and so damn valuable.
Well, first of all, I appreciate the question, and thanks for giving us the opportunity to just share our story. We have been a bit more under the radar, and that's been by design. We like to focus on our business, focus on our customers, and I think just as a side editorial point, I think there's a lot of startups out there and founders who preen for the camera more than spending time with their customers. And we've taken the approach that we like to focus on our customers, and as a side point to other fledgling startups, I think that's a good approach to take. But about us, we are tackling we're tackling back and joint pain. And we started in chronic back and joint pain. We've expanded beyond that. We're building a digital clinic specifically focused on back and joint pain. And you might ask, well, why are you so focused on musculoskeletal health, which is essentially back and joint pain? And the reason is it's very expensive. If you think about healthcare overall in America, as just high level numbers that probably we're all aware of, it's about 1/5 of the GDP is spent on healthcare, and 1/6 of that is musculoskeletal. So that when you think about it, 3 to 3.3 points of GDP is just orthopedics and musculoskeletal health. And so it's an enormous amount of spend that's happening. Now, what's interesting about musculoskeletal health versus some other areas in medicine is that musculoskeletal health hasn't attracted as much innovation from the digital health community in the years leading up to Hinge Health. And there's a variety of theories I've put forward. There was a lot of important areas of healthcare that I wouldn't discount, diabetes care, maternal health, cancer, mental health, all very important indications, but also indications where you might have more likely to have an occasional, say, death or an emotional moment. A heart attack is a very emotional moment, could bring cardiovascular disease to the top of the conversation. Same with a death from cancer or neonatal complications. Now, there's not many people who might die, and on their death certificate they say, died of knee arthritis or died of back pain. Now, I would argue that, you might have had the heart attack because you couldn't exercise because your knee hurts, or there might have been a suicide because you couldn't work and therefore couldn't provide for your family because of an underlying back pain, right? But it would be the mental health that is credited with the suicide and the spotlight on mental health, not the underlying chronic pain condition that significantly impacted the underlying depression. And again, the high blood pressure or the cardiovascular event would be credited with the death, not the underlying musculoskeletal condition that prevented this person from staying well.
It's so ubiquitous. Like, I couldn't believe 80% of the US population suffers from a back pain, joint pain, some sort of musculoskeletal condition.
Massive problem, very expensive, it's very common as well. It's a hub to our health, and we almost overlook it. You're absolutely right, Josh. We almost overlook it. People are just complaining about their back pain today, or just complaining about their knee pain, and not seeing how much of a facet that has on the rest of our lives. So that's why we're so interested in MSK. Certainly the folks paying for healthcare has noticed how big it is, but for whatever reason, it wasn't a big area of focus for entrepreneurs. But because of my background in breaking a couple bones when I was younger, and saying my co-founder, we thought it was very interesting, and so we decided to dip in.
All right, so talk a little bit about what you built here, because it's a little bit different than some of the other startups that are out there that are tackling this problem. I mean, so there are 5 companies that are kind of in this MSK space. One of them was acquired by Omada, that's Physera, and then there are others. Kaya Health. There are a few more. But what makes you guys so different? Like, tell me a little bit about the way that the Hinge Health solution is architected.
Absolutely. So first of all, what we've done at Hinge Health is we've taken best practice care guidelines for conservative management, non-surgical, non-opiate care for back and joint pain. And we've used technology to better deliver it. And we thought to ourselves, how can we better deliver exercise therapy, patient education, behavioral health support? All of it's quite onerous and challenging to deliver, and it's difficult to get reimbursed in the healthcare system for that. So so what makes us different at Hinge Health is a few things. One is the product, in that we pioneered using sensor technology combined with physical therapists and health coaches to really drive very strong clinical outcomes, but importantly, adherence. The issue with musculoskeletal care isn't that we haven't known what to do. It's that we know what needs to be done. It's just not happening. And how do we better deliver the guidelines and the recommendations that have been published for years? And that's a really focus on at Hinge Health. So what our product really separates us. And then secondly, from that is the outcomes we've been able to achieve. Because we spur such high adherence rates to our program, we're avoiding 2 and 3 surgeries for people going through our program. We just published a 10,000 patient cohort study last year with Stanford, UCSF, and Vanderbilt, demonstrating a significant improvement in pain, near 70% improvement in pain, 2 and 3 surgeries avoided, and 3 and 4 people completing the program. And that's really the crux of it. And when you dig down into any digital health company, the biggest challenges for whether it's a mental health digital health company or diabetes or back and joint pain, the biggest challenge is always adherence. How do we get someone to do something they don't want to do? And in our case, it's to move a painful joint. And they'd much rather watch TV. The easy choice is often surgery. How do we get them to do that? And then the third bit that makes us different, other than our pioneering product, the clinical outcomes we've been able to achieve, is really our enterprise readiness. As a company, as an organization, we've really kept our head down and thought to ourselves, hey, you know what? The end user is a patient, but often that patient is not paying for their care. It's being paid for by the insurance company, it's being paid for the employer. So you really have 2 sales involved. You have to think about being consumer friendly for that end user. Then you have to think about being enterprise friendly. And we have fought hard to be the most user friendly for the patient, as well as the most enterprise friendly. And we've really focused on our enterprise readiness, our implementation processes, such that we have 100% client retention. People could turn us on quickly. And for benefits managers dealing with COVID-19, dealing with a bunch of other challenges, we try to make it clear that if you turn on Hinge Health, it's not going to be a big body of work. We can get it done.
That's good. I think it sounds like you figured out how to digital health, because I think all 3 of those points that you touched on are like some of the biggest challenges about how to integrate a digital health solution into our incumbent healthcare system. I want to go back on point number 2 real quick, and I'm curious to see if you could get a little bit deeper in terms of your adherence numbers. Are there any numbers that you can boast about to us here about how good your adherence is? Because that really, like you said, is often the crux of not just any digital solution, but any type of healthcare solution. I mean, medication adherence is a huge problem. That's taking a pill. So talk a little bit more about your adherence, and if you can let us in on maybe some numbers and maybe the secret sauce about what you think makes Hinge so user-friendly that somebody wants to use it as opposed to abandon it.
That's a great question. There's no one secret solution to adherence. Every patient is different in terms of how you can engage them, and that's why we take a very personalized approach. But we are, in terms of the numbers, we actually published, as mentioned, a 10,000 person cohort study. Yeah. 70% of people completed our program through 12 weeks, and the average pain reduction was about 68% for the people going through the program. So a significant reduction in pain, and a very, very high completion rate for people going. It's about the typical adherence rate for at-home physical therapy is around 15%. So our adherence rate is around 4x higher than what you'll see in the community, and our pain reduction is about 4 times more than what you'd get with opiates, because opiates are good for acute pain. They shouldn't be given to chronic pain, but they're unfortunately often are given, and our pain reduction is even higher than opiates without the concomitant side effects.
Okay, and that other care that was delivered that you're benchmarking against, is that the physical therapy visits, or
prescribing people at home physical therapy? If you think about It's a great point. Like what is at, how does status quo look? The status quo might look, let's take a day off work or half day off work. I'm going to pay a copay, see a physical therapist. We find most physical therapists are remarkable providers, very dedicated to their patients. And it could be relatively challenging, however, to see your physical therapist 2 to 3 times a week. So what eventually happens is they're going to give you a piece of paper and tell you to do these exercises at home. And at-home adherence or adherence with at-home physical therapy has been seen to be very low, as low as 15%. And it's very difficult to track. And so what we've been able to build is a product that you could actually use wherever you are. It meets the member where they are. So we have wearable sensors that guide you through your exercise therapy from the comfort of your own home. And Jessica, if you've missed a couple of days and it's coming on to Friday and you haven't quite hit your goal for your exercises this week, your personal health coach could reach out to you and really think about and encourage you to finish your exercises for this week or to hit your goal. And the issue is, whatever might be keeping you from adhering this week is unique to you, Jessica. It might be that your kid is sick, or let's say your spouse is traveling this week, or you have extra work and a deadline that's coming up. And so, or you have in-laws visiting or a sick child, like whatever it might be that, life comes up. And for the issue with chronic conditions is that they're always with us and life is always with us. So life comes up and the role of our coaches are, how can I help you navigate life's various unexpected things that might arise, such that you could focus 15 minutes today for your hip pain or 15 minutes today for your back pain. And so a lot of the coaches' work is helping people fit this program into their lives. And of course, our physical therapists are there to make sure that we're designing our clinical programs optimally just for you.
Speaking of fitting things in, any designs on adding on other conditions yourself to tackle? Because I know this is often joint pain, back pain is comorbid with other issues. And like I said at the beginning, I came across Hinge the first time where it was a diabetes management solution that was looking to acquire, and there was conversations about who's it going to be, and your name was one of the names that was floated out there. So do you guys have any designs about adding other things to help kind of tackle some of those extra things that might come up to prevent somebody from adhering?
That's a great question. So it was probably the biggest barrier sometimes to adherence is just access and making it as easy as possible. So we've really thought of one of our product goals is always making things as easy as possible. But thinking about specifically comorbidities and how we can better address those, because you're absolutely right. Mental health is a very common comorbidity with musculoskeletal conditions. Sure. People who have depression or anxiety, they're just more likely to be impacted by a chronic pain condition. So let's say, we have 2 people, one is depressed, one isn't, they both have 3 out of 10 pain. The person who has depression is going to feel like that 3 out of 10 pain is having a bigger impact on their life, bigger impact on their ability to just get to work and care for themselves or live their life today. So we really think about the mental health comorbidities, and we're actually reducing depression and anxiety rate by about 60 to 70% for people going through our program. So we have focused on mental health and having a really big impact on those outcomes. But in the context of MSK, we're doing that because we know we're gonna have a ceiling in how good we could get on our back and joint pain outcomes if we don't also address folks' mental health. Another bit is weight loss, and you're absolutely right to point that out. That if you're a bit heavier, you have more weight on your joints, it's going to impact particularly your knee and your hip pain, even your shoulder pain, given how you might get out of a chair, somewhat less so for back pain. But we adjust our education when somebody, has a higher BMI, because we know that's going to impact our ability to reduce their back and joint pain. So we absolutely adjust our education, adjust our coaching, and achieve very meaningful weight loss for our participants. We're not a weight loss app, but we do achieve very meaningful weight loss. And it also helps people to lose weight when their joints aren't hurting, they can suddenly walk.
Yeah, they can actually go for a walk, or all sorts of things. It's like you can move better, you feel better. I'm asking this because in the context of this massive amount of funding that you're sitting on top of right now, I'm sure everybody who's watching this, well, at least a certain percentage of them are wondering, like, what are they going to acquire? And I want to talk a little bit about this. I want to talk about your business model and dive into that side of things. Sure. Now that we have a better understanding about the care delivery side. And so let's talk about this fundraise, and let's talk about what you have your eye on in terms of moving forward. And I'm going to say this to you because I read it. So it's not even a rumor because it came from you, but IPO plans in 2022. Tell us a little bit about that, huh?
Well, I ran my mouth to Reuters, as we know. And so I would say in our Series D, what we're really excited about is incredible investor interest in Hinge Health, which really reaffirms our strategy of focusing on back and joint pain, which is, again, the largest cost driver in the healthcare industry. 1 in 6 healthcare dollars are spent on back and joint pain. We had $400 million of commitments within
Amazing.
22 hours of opening the round. So it was like there was a lot of interest, and we've essentially IPO'd, at least from a capital perspective, in terms of how much we raised. The average IPO, I think this past year was raised like 350 million or so, and we raised 300. We could have raised 600 if we wanted to. There was that much interest in Hinge Health stock. So our focus right now is realizing the opportunity ahead of us, providing the best possible care that our members and our customers can possibly receive. But we're keeping all options on the table, including our IPO. We'd like to be operationally ready to go IPO in 2022. I'm not going to give a timeline of when in 2022, but there's a lot that goes into it that's in our control in terms of maturing as a company, your financial maturity, your accounting maturity, that sort of public market readiness. I could confirm we are absolutely laser focused on doing that because we want to build a business to last. Now, the precise timeline is sometimes out of my control in terms of how's the market's looking and et cetera. And so I'm very happy to say our soft goal is sometime in 2022, depending on how the market is shaping up, but it might change. But we've been at this for 6+ years. I think it's time to give some liquidity to our early employees, and it's an important milestone in any company's maturation to
Absolutely. And I think that, especially where the market is at after the year that we experienced in health technology in 2020, I feel like 21 is, already we've seen Talkspace file for an IPO. That's pretty exciting. So I think, in fact, what's funny is I was telling somebody earlier that I was interviewing you, and I mentioned that comment that you made to Reuters about 2022. And it was like, the comment I got back was not like, that's crazy or anything like that. Instead, it was like, why aren't they going to just go this year? So you've definitely got some support behind you. I want to ask about, because also in that chatty Reuters interview, threw out some revenue numbers there. So you cruised past 100 million in revenue, and now you're headed straight towards 200. You said confidence in clearing that. So tell me a little bit about how you're going to do that. So if this year is a year where you're planning on getting your business operationally mature, I love that phraseology, to IPO and go public next year, what are the things that you're looking at doing this year to not only build that maturity, but also generate the revenue that you need to continue to perpetuate the business and move it forward? So tell us what's on your roadmap here. Give us a little indication. And if you want to pepper in there any potential areas for acquisition or things that you're looking to add on, we'd love to hear that too.
I think that's a great question. So we were very fortunate to have had very strong revenue growth over multiple years. I think our revenues tripled every year for the past 4 years, and so we've consistently delivered very strong revenue growth as a business and very strong returns to our investors. And we're very lucky to say that currently 4 in 5 employers who have bought a digital MSK solution have bought Hinge Health. And so we're incredibly fortunate, and I've been deeply indebted to my team, as well as in particular our early customers who were so visionary and took a risk on us and gave us important feedback, as well as our partners as well. And so that's been enormously impactful for us. And so 4 in 5 employers have bought Hinge. 4 in 5 employers who've purchased digital MSK solution have purchased Hinge Health. What's great is that only 10% of employers or so have a digital MSK solution, and National Business Group on Health, or the Business Group on Health based in Washington, D.C., forecasts that 70% of employers will have a digital MSK solution within the next 2 years, according to their survey results from large.
There's a lot of market to go there.
Exactly. We're really excited about the growth ahead, really excited about our market leadership position. And in particular, our market leadership allows us to better define this space. We are creating a category of digital MSK. There are others, as you point out, that are in digital MSK who, are marching in our footsteps, which we appreciate, and it's validating the market. But in our leadership position, we're able to define what great should look like, what are the key feature sets that are required in this space, and we've really embraced that, similar to what Livongo did for cardiovascular. They really own that space. They defined it. They defined what good should look like, and we're doing something analogous here in back and joint pain.
Okay. Speaking of Livongo and their diabetes management and cardiovascular care, their whole big platform solution acquired by Teladoc, that was big news last year. They were, for a while, they were looking to add on a MSK solution, and now it looks like Teladoc is offering some sort of MSK service. There was a slide in Jason Gorovich's CES presentation that spoke to that. But who do you think you guys are competing against? Like, tell me a little bit about where you see yourselves in terms of competition, because there are other obvious providers of MSK solutions like Vizera that's now part of Omada. You've got somebody like Teladoc who's got that virtual care network built out, can easily get into the home. They've got their chronic condition management solution attached to them now. I mean, are those who you see as your top competitors, or could it be more like a grand rounds that does the second opinion so that people don't have to get a back surgery, and they're saving employers saving employers money in that way, in a different approach? I mean, I don't know, who do you see as your top competitors in this space?
Hey, it's a great question, Jessica. Status quo, absolutely. It is using brick and mortar care. We see that as the biggest competitor to us and the biggest barrier to adopting digital MSK solutions. When it comes to digital MSK, we're winning 80-85% of customers who are purchasing these solutions. So we don't see our main competition as others in this space. We think it's great that others are in this space. It validates the space. It increases innovation. So we're very firm believers in robust competition in that sense. But our biggest competitor is still convincing someone who's never purchased a solution like this that this solution is needed, and that there is a better is possible, and that MSK care can be digitized and delivered effectively, and you could get fantastic outcomes, approximating in person, and in many ways exceeding in-person care or the outcomes you could achieve in person care, because the outcomes are so strong. And so again, 4 in 5 employers have already chosen us. Our channel partners give us now access, or our main channel partners are health plans and consultants. But just focusing on health plans, we've really focused on building out an ecosystem of health plan partners to where now well over 50% of members across America on employer-sponsored plans will be able to have access to Hinge Health via their health plan contract. And so that's been something we've really, put our heads down to focus, such that, if we stopped doing that today, we would still have over 50% of the market when all is said and done. And so that's something that we've really built out to show that we're different. And in order to continue to win the market, we're really not resting on our laurels. We are, as a company, our mascot is cockroaches. We call ourselves, cockroaches. Our Employee of the Month award is called Cockroach of the Month. And we recognize that when, there are booms and busts in any industry, and, we saw a bit of a mini bust, I should say, last spring during COVID, we at Hinge Health, we endured no layoffs, no salary cuts. There were customers who were under stress, and therefore revenue that was impacted, but we had built a company that was able to take that sort of a punch. And that's what we're trying to do, is remain paranoid, remain a company that's thinking a couple of steps ahead. And what I could promise you is that we're going to use the capital to really invest in our innovation and R&D team and to stay different. We're not just going to do the obvious moves. I think the obvious moves are, when is Hinge launching a diabetes product? When is Hinge moving into, respiratory, or, launching their free mental health product? Those are obvious augmentations. And those companies that are thinking obviously are not the ones who are capturing the most market share. In fact, you mentioned Vizera earlier. They did sell to Omada for $30 million, and 6 months later, we're valued at $3 billion. So it's 100x different. So you could see the amount of value that accrues to, one, the industry leader and the category leader who's trailblazing it, and two, the truly differentiated solution. And there are many solutions who are essentially trying to say we're digital PT. We don't see ourselves as digital PT. I think physical therapy is an important component to robust musculoskeletal care, but it's a component for robust musculoskeletal care, particularly for chronic musculoskeletal conditions, which is 75% of MSK spend. You really have to go beyond just PT. And that's really benefited us by thinking more holistically around the patient.
I love that. Beyond the PT, a full digital solution. And I cannot believe how much market there is left. So thank you for sharing all of the statistics around that, because that's pretty remarkable. 70% of employers are going to be looking for that. 10% have it now. Is that right? Did I get that right?
That's what we're seeing. Yeah.
Woo, all right. Well, Dan, thank you so much for stopping by and for sharing some of the insight on the MSK market, as lucrative as it appears to be, and also for sharing about the phenomenal success that your business has accomplished so far by just being cockroach, which is pretty remarkable as well. So thank you again. I appreciate your time. We will definitely be keeping our eyes out for that impending IPO whenever it may happen, and for all of the milestones that are hit along the way. Everybody, Dan Perez, remember him, co-founder and CEO of Hinge Health. We'll be keeping our eye on you. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us. We'll talk to you soon.
Thank you.